In my experience as an emergency room nurse and nurse practitioner, I would say 80% of people who come into emergency room are not prepared for the questions we ask. Let me tell you how you can be. I want to talk to you today about 3 things that you should prepare ahead of time to have ready for when you have an emergency room visit. Especially, you should have this ready because you might not be awake when you come in. We see people arrive by ambulance, they're unconscious for whatever reason, stroke, car wreck, fall, and then some family member tries to answer the questions and doesn't really know. That's not a help. And contrary to what many people think, we cannot access all of your records from all the other hospitals. We're advancing in this country, but we are not yet able to access all the records from all the different hospitals. So it's important you have some things. And it's as simple, honestly, as writing it down on a piece of paper. I'll talk to you about the things we need to write down. I want to give you 3 things that will help you if you end up in an emergency situation. We'll talk about each of them individually. It won't take long. And I would recommend, if you appreciate this kind of information, then hit or subscribe. And I'll make more videos like this to try to help you out when things go wrong. I'm John Larson. I have been working in emergency rooms or in ambulances or as a flight nurse in one role or another over the last 20 years. I've seen a lot of people in emergency situations. I've seen a lot of things go wrong. I've seen a lot of things go well. And I will tell you about some of these things today. But the very first thing you need to know is you need to have just a piece of paper or a notebook with your emergency medical information. That's a piece of paper that has the things written down. So if you can't talk, it can talk for you. It's very simple. The first thing to have may seem dumb, but it's very important, your name and your birthday. We don't look through all of your wallets. We don't dig through everything. There's just not time. People have that misconception, but we do not go through every single pocket you have and your wallet and your purse. So have a piece of paper on your emergency medical information, have your name and your birthday. That's what we need to register you in our computer. We have to have you in a computer to be able to treat you. In today's computerized world, it's almost impossible to just treat someone without having you registered. So your name and your birthday. We would like to know your emergency contacts. If you're alone, this is especially important because then we know who to call. So their name, their phone number, and their relationship to you. It can be just one, but 2 is even better in case one person isn't near a phone. Emergency contacts. We would like to know anything very special about you, and especially we would like to know your code status. I'll talk more about that in a minute, but basically that is one of 2 things, full code or DNR, do not resuscitate. Keep that in mind. I'll talk about it more in a minute. I won't repeat myself here over and over again. We'd like to know your allergies, especially medications and severe allergies, things that radically could affect your life or even kill you. So for instance, if it's penicillin, that's a common one we hear, penicillin, and it causes hives, or penicillin causes you to stop breathing, or penicillin, a mild rash. That can make a difference in the heat of treating you, because sometimes we might be worth giving you a medicine. If it's just a rash, we can treat that, but if it's going to threaten your life, we'll definitely try to find something different. So your allergies, if there is a food that would kill you, we need to know that. And then, do you have any special religious needs, such as the most famous one in this country is the Jehovah's Witness do not want blood products? Write that down, because again, if you're unconscious, we need to know those things. So if you have any special needs or prohibitions due to religious faith or even your own personal convictions, write that down. We need to know that. Doctors and specialists, we need a place for your family doctor. We need a place for any specialist you have, and a pharmacist or your pharmacy. And please put their name, their phone number, and if it's a specialist, what they treat you for. If it's especially one of these very highly specialized, the one I can think of first is a transplant doctor or a transplant team. We definitely need that. Transplants are one of those things that we want to be able to talk to your transplant team. And most transplant teams have somebody that will answer a phone 24 hours a day. They're amazingly responsive and they really know their patients well. So any very special people that we would need to be able to contact on your list. And then, of course, current medical conditions. Do you have high blood pressure? Do you have congestive heart failure? Do you have heart stents? Do you have diabetes? What kind of diabetes? Do you have any surgeries that still affect you? For instance, have you had a surgery just a month ago and you're still healing? We need to know that. And if you have any implanted devices in your body, a pacemaker, a nerve stimulator, I've seen other things as well, but any implanted devices or gadgets in your body, we need to know that sort of thing. And of course, medications. You can give us the generic or you can give us the brand name. That doesn't matter to us too much. But the name of the medication, the dose, for instance, 50 milligrams, how often you take it, like once a day, twice a day, or at bedtime if it's a certain time of day, how often you take it, and what it is for. And that's important because there are some medications that are used for more than one thing. So why are you taking it? For instance, this medication, is it for high blood pressure? Or is it for congestive heart failure? Or is it for both? Please write that down. And if you need to, if you're one of these people that cuts pills in half, you can put down there that you have a 50 milligram pill cut in half. That's fine. We can deal with that. As long as it's written down, we can find that information. We also like to know supplements, if you're taking any supplement, because if you're taking like high dose vitamin E every day, that could affect things in some ways. And especially any dietary, like diet pills, diet supplements, things like that. All of those, write them down. If this seems a little complicated to you, I'm using a cheat sheet here to make myself remember. It is hard to remember all this stuff. I'll put a link in the pinned comment at the bottom of this video where you can go to just download a simple Google Doc I've made of this information. It's simple. You don't have to buy any fancy books or cards or anything. A notebook, a piece of paper, fold it in a wallet will do it. And then do me a favor. If you do this, then either photocopy it and give a copy to the people who travel with you a lot, or even better, have them take a picture of it on their phone and you take a picture of it on your phone. It seems that people lose that piece of paper in their purse or their wallet, but they never lose their phone. So take a picture of it, have it on your phone, and we'll be able to get it. If you tell us it's there, we'll take the time to find it for you. So number one, we want your medical emergency information. Number two, I told you I'd talk about this, code status. Now, code status in the emergency room, it might not be what you think it is. I've had people tell me things like, try a little bit, but don't do a lot. Or only try if you know you'll be able to bring me back and I won't have brain damage. Those things are impossible to predict in an emergency room. In an emergency room, imagine this, we walk into the room, you just took your last breath and you stop. In 1 second, we need to decide, do we start resuscitation on you or not? So it is an all or nothing situation in an emergency room. So code status is just this, full code, which means do everything we're trained to do to try to save your life. Chest compressions, which is CPR, a breathing tube if we need it, all the medications we have, advanced IV lines, everything we can do to save your life, or DNR, which means do not resuscitate. Some people now are saying allow natural death, which means we give you medications. We'll give you any medication we can. We'll give you IV fluids. We'll give you oxygen if we can do it with a mask, but we won't do the invasive things. We will not do chest compressions, and we will not put a breathing tube down your throat. That's the two big things that we will not do. And if you want to be DNR, that's your right. There is no right or wrong answer. The answer is we want to do what you want to happen. Now, with that said, the question comes up, will I stay on a breathing tube the rest of my life then? If you can't get me back, what happens? I'll make another video about that. That's called the medical power of attorney. That's where you have someone else who can make that decision for you. And again, look on my channel. I'll make a video about that, medical power of attorney and what things you need to know. Because again, I'm talking emergency rooms, but in an emergency department, things don't always go the way people think they would. And now the last thing, your bonus material. Item number 3 you should consider is the idea of what people commonly call life flight, the helicopter services that take people around. Because in a lot of our nation, you're in a rural area and the local hospital might have one doctor and 3 nurses, and that's it. They have no specialist. They have no advanced machines. They have nothing like that. They are a life-saving, stabilizing emergency department, but anything complicated gets transferred to a larger center. And if these transfers are 2 or 3 hours away, which in the countryside of America it can often be, then you're put on a helicopter, most commonly, and flown there. Most people call this life flight. That's what I'll call it here. And when you're put on life flight, this can cost anywhere from $60,000 to over $100,000. I used to work for one of these companies. We did, in my opinion, great work, but we carried a lot of people because we were in rural America. We carried them from the side of the road because ambulance services call them straight to a significant auto accident. We flew them from national parks where they fell off of rocks, and we flew them from a lot of little county hospitals, like I said, that only had one bed or one doctor, or just a couple of beds, few nurses. So if you're put on that, it can cost a lot of money. Now, most of these companies offer membership. The mistaken thing is a lot of people that I heard say is, I have life flight insurance. There are some companies that offer that, so you could be right, but commonly they meant they had a membership, which I'll make up the names of companies. If you're an old Roadrunner fan, if you flew on Acme helicopter service and you had an Acme membership, then the Acme helicopter service did not bill you. They'll bill your insurance, but whatever insurance doesn't pay, they don't bill you. So you have nothing out of pocket. You're not devastated by this cost. That's a great thing. But if you're not on Acme, if you're on Yellowstone helicopter service, then guess what? They still bill, and they bill you because you don't have insurance. You have a membership, and a membership only covers you for the helicopter service where you're a member. It's that simple. So you need to research this. You need to know what you have. If you bought a product, you need to know what you bought. You need to know if by some chance there are companies that offer insurance, or if it's nothing more than a membership. Although I hate to say nothing more than a membership, because there are some areas where one company pretty well is the only service in town. So that's the one you'll be using. And in those areas, a membership can be great. And the other thing, just because I used to work for one of these companies, I'll say this, the memberships are what help pay for all the free things we did for the community. We trained fire departments, we went to schools. If we were called to an accident site and then told that, no, you're not needed, go back, the membership's what paid for the fuel and the cost of that. So the memberships do a lot of good things, but I don't want you to have something that surprises you later. So find out, do you have a membership or do you have insurance? Or if you have nothing, would it be wise to get that in the area you live or in the area where you're traveling? As simple as that. 3 things to be ready for that unexpected emergency. The most important, your emergency medical information. Download the sheet that I made and fill that out. The second, your code status, have that clearly in mind. And then third, not necessary, but it is nice to think of this ahead of time. How will you manage it if you're put on a life flight helicopter? Do you need a membership, or does your area have an insurance plan? How will you pay for that? How will you deal with that? So those 3 things, prepare that. And again, if you like this sort of information, you can subscribe. I'll make more. And watch for my 2 other videos. I made another video for you about the power of attorney and the DNR and what that means in detail. And then another video on how you can use your iPhone to gather and collect all this information in one simple app, and it will be there. And believe it or not, in an emergency, any emergency personnel, either at the roadside or at the hospital, that has your iPhone in their hand can get your information. It's simple, it's easy, and it's very reliable. So thank you. Tune in again.